It wasn't until 1970 that perinatal loss was even recognized as an emotional response. It was just assumed that parents who experience perinatal loss, even stillbirth, late stage pregnancy, stillbirth, or neonatal death, death of an infant, it was assumed that, they didn't know the baby, they didn't really care about the baby, there was no emotional bond. But that's not the case at all. And it's because of research and listening to those who have experienced this type of loss that we can understand, no, this is an emotional experience. This is a very life-impacting experience. And it's not something that parents can just go through, forget about, and go on with their life. It's so much more complicated than that. So many people don't understand how prevalent reproductive and perinatal loss is. They don't know that 1 in 4 pregnancies ends in loss because it's so silent and it's stigmatized, and parents learn you don't talk about it because nobody wants to hear about it. If healthcare professionals like myself and others just say, okay, it's done, go ahead and go on with your life, then that's not a realistic expectation of them just recovering. So follow-up care is probably one of the biggest gaps. It's assumed that the pregnancy experience with loss is like a book. There's the beginning with the pregnancy and the end of the pregnancy, and that book is closed and put on a shelf, and no one thinks about it after that. There's not a lot of education in pre-licensure and health professions like nursing and medicine. There's not a lot of continuing education for healthcare professionals. So thank you, Life Perspectives. But if healthcare professionals don't know how impactful this experience is, don't know which words are trigger words, don't know what parents need, then they can't provide those resources to them and they can't help them through this process.